I wanted to do medicine probably ever since I was a kid. It was inspired, I think, by my mother, who was a nurse. And she had got me one of those play school doctor's kits, and I enjoyed using that to do checkups on my siblings, my dolls. And what I found is that with cardiology, congenital cardiology, pediatric cardiology, is that you can start with the patient as early as when they're born, depending on if they have the condition they're born with or if they develop one, and you can really follow them throughout their life. So I thought that was a great way to still get to see my patients and follow them as they grow up, would be to start with the little hearts. I see patients for general cardiac concerns, things like palpitations, which is skipping beats or fast heartbeats, or the sensation of that. I see patients for chest pain and other concerns if there's a family history of congenital heart disease. So I help with screenings in that way. I also, here at the Cleveland Clinic, have assumed the role of the main physician for the cholesterol or the lipid clinic. These are children who have abnormal cholesterol levels. So that's something that I'm taking on as my subspecialty, if you will. When you take care of children and adolescents, they do come with their families most of the time. And you want to make sure as the provider that you are addressing the patient's questions. But you're often getting the history from both the patient and the patient's relatives. So you want to make sure that you're addressing primarily what the patient's concerns and the parent or the guardian's concerns are. So I'll make sure that as we're going through the visit, that all their concerns are met, whatever questions they have are answered. As physicians, a significant part of our job is education, educating the patient on the condition they have, how we manage it or treat it, what other things that they should be looking for, other things that would be concerning and would warrant that they should come back to see me or come back sooner than our plan.